Hey guys, we are your fellow second year medical laboratory science students. Today, we will be presenting a patient case report about vanishing bone disease, or otherwise known as Gorham-Stout disease. A few of the things we will talk about will be the epidemiology, pathogenesis, treatment, etc., just to name a few. So, what is vanishing bone disease? It is a rare occurring disease which is characterized by the progressive destruction of the osseous matrix, accompanied by the abnormal proliferation of vascular structures, leading to the destruction and absorption of bone. Vanishing bone disease does not discriminate in its choices of target. It can affect multiple bones throughout the body, including the skull, upper and lower limbs, the spine, and the pelvis. Understanding this rare disease is crucial as we work towards better diagnosis and treatment options for those affected. So, there are less than 300 cases reported of vanishing bone disease in literature to date. This disease can affect individuals across a wide age range, from infancy to 75 years old, although it is most commonly diagnosed in people under 40. Interestingly, there is no significant connection between the incidence of vanishing bone disease and factors such as race or geographic location. However, the male-female ratio of those affected is approximately 1.6 to 1, indicating a slight male predominance. Vanishing bone disease's specific cause remains a mystery. Despite extensive research into its pathogenesis, the definitive etiology of this condition has yet to be determined. Several theories have been proposed to explain the underlying mechanisms. Some suggest that the vascular endothelium plays a crucial role, while others point to the involvement of multinuclear osteoclasts and mononuclear phagocytes in the process of bone resorption. These theories highlight the complexity of vanishing bone disease and underscores the need for continued research to uncover the exact causes and mechanisms driving this rare and perplexing condition. While the specific cause of vanishing bone disease remains elusive, significant insights have been gained from research. Notably, Dixon et al. In 1987 discovered the involvement of alkaline and acid phosphatase activities and highlighted the role of mononuclear phagocytes, multinuclear osteoclasts, and vascular endothelium in bone degradation. This finding pointed to the complex cellular interaction driving the disease. Further advancing our understanding, Devlin et al. In 1996 identified increased osteoclast activity and elevated levels of interleukin-6 in the early stages of the disease. This suggested a critical role for interleukin-6 in the pathological bone resorption observed in vanishing bone disease. These pivotal discoveries underscore the importance of cellular and molecular studies in uncovering the mechanisms behind this rare and perplexing condition. As mentioned before, vanishing bone disease is a rare disease characterized by the destruction of osseous matrix and proliferation of benign vascular structures with an unclear etiology. The first case of vanishing bone disease was reported in 1838 by Jackson, who documented a young man with a gradually vanishing humerus. This syndrome is classified as type 4 of osteolysis among 5 identified types. Vanishing bone disease is characterized by the progressive disappearance of bone tissue and typically affects the spine, skull, or pelvis. Although the exact cause of vanishing bone disease is unknown, it is believed to be related to an abnormality in the lymphatic system. So this patient case report was presented with a 32-year-old Caucasian man with no prior significant medical history. He came into the hospital presenting the following symptoms: progressive pain and swelling in his left shoulder, accompanied with fatigue, limited shoulder mobility, occasional night sweats. He claimed that these symptoms began gradually over 6 months. So, upon arrival at the hospital in July 2023, a physical examination was performed from which muscle atrophy and decreased range of motion was noticed. Diagnostic tests were performed, like the radiographic imaging, which showed osteolytic lesions in the left humerus. Other diagnostic tests included laboratory tests, which ruled out infections and metabolic bone diseases, the MRI and CT scan, which also confirmed the presence of extensive bone loss and soft tissue infiltration consistent with vanishing bone disease. Thus, a bone biopsy was sent to histopathology, which then showed angiomatous tissue and absence of normal bone structure. Furthermore, bone scintigraphy demonstrated increased radiotracer uptake the lesion sites. The angiography emphasized the abnormal vascularization within the affected bone. Thus, the 32-year-old man was diagnosed with vanishing bone disease. However, he received treatment as soon as possible. The man was at impending fracture risk. Thus, he underwent surgical stabilization of the left humerus using internal fixation with plates and screws. Also, in order to relieve pressure and increase mobility, a large amount of the fibrous tissue surrounding the bone was simultaneously removed. Post-surgery, the biphosphonate therapy is initiated to prevent osteoclastic activity and to maintain bone density. A few other treatments included physical rehabilitation, psychosocial support, and medication management. Upon follow-up, the patient experienced significant pain relief and improved shoulder mobility within the first month of surgery. His imaging showed stable internal fixation and early signs of bone healing. Physical rehabilitation led to significant gains in shoulder range of motion and muscle strength. Bisphosphonate therapy stabilized bone density, supporting ongoing management of vanishing bone disease progression. Psychosocial support improved emotional resilience and coping skills. With ongoing multidisciplinary care and regular monitoring, the patient's prognosis is favorable, focusing on maintaining functional gains and managing disease progression effectively. The prognosis of vanishing bone disease is extremely unpredictable, with the possibility of serious complications, particularly when multiple bones are involved. Extensive research has been done to better understand the molecular mechanisms underlying this disease, and systematic efforts are underway to identify potential pharmacological targets. Vanishing bone disease symptoms include localized pain, swelling, weakness, and functional impairment in the affected limbs. When the spine is involved, paralysis may occur. Patients in the dentoalveolar region may experience mobile teeth, malocclusions, mandibular deviation, and bony deformity. If any of these symptoms appear, seek medical attention immediately, as vanishing bone disease can result in serious complications such as bone resorption, osteoporosis, fractures, deformities, and severe pain. Diagnosing vanishing bone disease can be challenging due to its rarity and variable presentation. The diagnosis involves multiple imaging and diagnostic techniques to accurately assess and monitor the condition. Initial imaging with X-rays may reveal areas of bone loss, although early changes can be subtle. Computer tomography, CT scans provide detailed images of bone structures, helping to detect changes in bone density and the architecture. MRI is valuable for evaluating soft tissue involvement, joint spaces, and detecting disease extension into surrounding tissues. Nuclear medicine imaging techniques, such as bone scans, can highlight areas of altered bone metabolism, aiding in diagnosis. In certain cases, a bone biopsy is performed to confirm vanishing bone disease by identifying osteolysis and ruling out other conditions. Laboratory tests are typically used to exclude infections or metabolic bone diseases that may present with similar symptoms. While rare, genetic testing may be considered if there is suspicion of a genetic predisposition to bone disorders. Together, these diagnostic tools are essential for a comprehensive evaluation and accurate diagnosis of vanishing bone disease. The progression of vanishing bone disease is still under extensive research, but several main features are commonly observed in the few reported cases. The disease is often associated with angiomatosis of blood vessels and sometimes lymphatic vessels, characterized by unusually wide capillary-like vessels with slow blood flow. This condition can lead to local hypoxia and a lowering of pH, activating hydrolytic enzymes. A key mechanism in vanishing bone disease progression is the replacement of normal bone with aggressively expanding, non-neoplastic vascular tissue. This process can affect various sites such as the shoulder and pelvis, though it rarely involves the spine. When the spine is affected, the prognosis is typically more severe, leading to neurological decline, immobilization, and subsequent comorbidities. Neurological decline often results in severe pulmonary complications like pleural effusion or chylothorax. The most frequent cause of death in vanishing bone disease patients are related to complications involving the spinal cord or chest. While still an object of research, several treatment options for vanishing bone disease have shown promise. These options include medical therapy, radiation, and surgery. In medical therapy, the use of bisphosphonates has yielded positive results due to their anti-osteolytic activity. Radiation therapy administered in moderate doses has produced satisfactory outcomes but carries long-term risks such as secondary malignancy and growth restriction in children and adolescents. Surgical options vary depending on the case. For instance, spinal involvement often necessitates spinal fusion to stabilize the spine and prevent neurological decline. Another surgical approach involves the resection of lesions followed by reconstruction using bone grafts or prostheses. Each treatment modality is tailored to the specific needs of the patient, offering potential benefits while considering the associated risks. Vanishing bone disease, also known as Gorham-Stout disease, is a rare and mysterious condition that challenges diagnosis and treatment. The disease, which is characterized by progressive bone loss and replacement with vascular or lymphatic tissues, can affect any bone in the body, resulting in a variety of symptoms and complications. The exact cause is unknown, but it is thought to be abnormal blood vessel growth within the bone. Our patient case report highlights the disease's complexity by detailing the diagnostic journey and the multidisciplinary approach required for management. Treatment focuses on symptom management and complication prevention, with promising options including bisphosphonates, radiation, and surgery tailored to each patient's needs. Ongoing research aims to uncover the underlying mechanisms and develop more effective treatments, providing hope for better outcomes for those suffering from this challenging condition. Thank you for listening to our presentation. Until next time, bye-bye.